Newsx, I'm Riya Dwivedi. Now let's take a look at some breaking news coming in. First case of HMPV virus has been found in India, and a 8-month-old baby boy has been diagnosed with HMPV virus infection after he was admitted in a private hospital in Bengaluru. As per the hospital sources, however, the baby has no travel history. And this HMPV virus is a common respiratory virus that primarily affects the lungs and airways. It can infect people of all ages but poses a higher risk for infants, young children, the elderly and those with weakened immune systems. Karnataka Health Ministry has also not confirmed officially that it's a case of HMPV virus or not, but samples from the patient are being sent to the National Institute of Virology to confirm. Karnataka Health Minister Dinesh Gundu Rao's office has said that there are a lot of variants for this virus and they are awaiting reports from the NIV to confirm whether this is the same virus that originated from China. So that's what we have been seeing, that the first case has been reported, but the test results are still awaited whether it is HMPV in fact or not. And Karnataka Health Ministry is keeping a tight eye on that. We have with us my colleague Belly Thomas joining us on the telecast. Belly, what are the details that are coming in terms of this HMPV virus that we are seeing? What are the details that are coming into the this boy that has whether he has contracted this or not?
Riya, this is a patient, that's a baby boy, 8-month-old and 8 days. He has been admitted at the Baptist Hospital in North Bengaluru, and the hospital, the private hospital, has diagnosed him with the human metapneumovirus, and he has been kept in isolation, and all precautions and all necessity interventions are being medically done at the hospital, where the patient is isolated and the parents are being kept informed of minute-to-minute developments, and the doctors treating the baby is also in constant touch with the family members. And though this hospital has released a report of the baby diagnosed with this particular visit that has gone viral on social media, and the health ministry has taken a note of it, and they have approached the hospital to send the baby's samples to the National Institute of Virology in Pune to waiting for confirmation. And there are also suggestions from the ministers, the state health ministry, stating that there are multiple variants of this particular virus, and the virus that has infected this baby could be one of the variant, and like a common cold symptom. So whereas taking no chances, this case is being treated very prominently with utmost care, and the samples have been sent to are being sent to the NIV in Pune, and the state health ministry hasn't officially declared that this is a human metapneumovirus, the particular variant that originated from China, Riya.
Belly, when it comes to the Karnataka Health Ministry, what advisory have they issued, and what are the actions and the initiatives that are being taken by the Karnataka government when it comes to tackling a situation like this?
Riya, like I said, the ministry doesn't want to take any chances, so this particular patient is being treated very with utmost care, and he has been isolated, and the doctors have been specifically instructed as to what SOPs need to be followed, and all those things, and also going by investigating into the actual scenarios like travel history. They have found no travel history of either the baby or their parents, none of them have traveled to China or any other countries recently, and the parents are not infected, and only the baby is infected. So there has been kind of speculations as to whether this could be the same virus or one of the variants that that the doctors say that it would be one of the forms of human metapneumovirus. So the advisories from the ministry is that like wearing a mask would be the primary one, and the elderly patients, especially the ones who are in palliative care, and pregnant women should be taking precautions as to this virus spreads is like high likelihood of spreading among those kind of patients, Ria.
We also have with us Dr. Ishwar Gilada joining us on the telecast. Dr. Ishwar, when it comes to this report that we are seeing that this is the first case of HMPV virus that has been found in India, and an 8-month-old baby boy has been diagnosed, but we're still awaiting the results whether it is what kind of variant it is. But in a situation like this, we are seeing that in a virus like this affects mostly infants, elderly, or people with a weakened immune system. I think we are facing some connection issues, but we also have with us Belly. Belly, when it comes to a virus like this, it affects infants and people with a weaker immunity system. When can the test results be, how long will the test results be declared to this 8-month-old baby boy that has been diagnosed with this?
Ria, the baby boy, so as of now is in stable condition and is being treated with all the directions from the health ministry, as well as from the virologists in the city, and the patient's life is not in any has no any issues as of now, and the samples have been sent to the NIV, where the communications would come to the ministry, say in about in 2 hours, in a couple of hours or so, and after which the state health ministry would declare whether it is the variant that originated from China or it is some other variant. There would be an identification on which variant this baby has contracted, and certainly the advisories and the norms that would follow after 4th. And this, there is also special instruction
Belly,
from the
stay on with us. We also have with us Dr. Ishwar Gilada. He's a health expert joining us on the telecast. Dr. Ishwar, we have seen that now when it comes to this first case that is being reported, the NIV report is still awaited to confirm whether this is the same virus from China or not. But when it comes to a situation like this, what can be, what should the doctors be expecting from this, and what should the action be taken to solve so that there's no no spread when it comes to a virus like this?
See, basically this is not a new virus. It's a re-emerging virus. It was first initially found in 2001 in Netherlands, and actually it has been in existence for 50 to 60 years as per the old sample reports. Now it is one of the respiratory viruses, so it is just like any RSV, that is a respiratory syncytial virus, or influenza A or influenza B type of virus, or COVID virus. So being a respiratory virus, it will spread through droplets, it will spread through sneezes, cough, and whatever precautions we learned during COVID, same needs to be followed. So sanitization, masking, social distancing, and the only difference with this virus is it affects mainly children and old people, whereas the COVID-19 was not affecting children. So children at higher risk, those people with comorbidities, uncontrolled diabetes, respiratory problem, asthma, tuberculosis, uncontrolled diabetes, they are at high risk. And people with age 60 plus, they are at high risk. So as a doctor, any doctor should keep a vigil that is a new respiratory virus. Unless until test is conducted and confirmed, we cannot say that this is HMPV virus. Otherwise, it is just like any other flu virus.
Dr. Ishwar, for the viewers who are watching our telecast, what advisory or what will you tell them regarding the symptoms of this HMPV virus, and when it comes to a virus like this, what exactly should they be knowing?
See, in the long term, the advisory is that we human beings have a right to survive. Similarly, every virus, every bacteria, every fungi, birds, parasites, everybody has a right to survive. So, like a mosquito bites us, we try to kill mosquito or we kill mosquito. Similarly, if human beings are intruding in the atmosphere of other animals, other birds, other habitats, other plants, they are going to be harmed. And these are all zoonotic infections. Zoonotic means they come from zoo, animals or birds, and then they spread in human beings. So when we introduce the atmosphere of other habitats, then we are bound to invite such trouble. Last 30, 40 years, whatever new infections are seen or re-emerging infections are seen, like SARS, COVID, HIV, or what you call Zika, Nipah, all these are zoonotic diseases.